Hypothyroidism, a disorder associated with the thyroid gland. Let's have an insight. The thyroid gland releases three hormones, T3, T4 and calcitonin. T3 and T4 are collectively the thyroid hormones. Calcitonin is considered as a pituitary hormone. The TSH produced by the brain, which stimulates the thyroid gland, play an important role in thyroid disorders, along with T3 and T4. Now, what is hypothyroidism? Hypothyroidism is a state where the thyroid gland doesn't make enough hormones to meet the body's needs, or rarely, the body remains insensitive to thyroid hormones. There are a number of causes for hypothyroidism, classified as primary, secondary, tertiary, and peripheral hypothyroidism. Primary hypothyroidism accounts to more than 95%. Oof, that much. In primary hypothyroidism, the thyroid gland fails to function. Here, TSH increases. T3 and T4 decreases. Secondary and tertiary hypothyroidism is due to failure of pituitary gland and hypothalamus, where serum levels of TSH, T3 and T4 decreases. In peripheral hypothyroidism, the body becomes insensitive to thyroid hormones. Here the hormone levels does not vary from normal. Let's look into primary hypothyroidism. The causes of primary hypothyroidism are defects in thyroid gland by birth due to a genetic cause, destruction of thyroid gland by the body's own immune system. The immune system fails to recognize the thyroid gland and attacks it. Hashimoto's thyroiditis and postpartum hypothyroidism belong to this class. The most common cause of primary hypothyroidism is induced, which are caused due to some external factors, such as removal of thyroid gland by surgery, hypothyroidism induced by drugs, iodine deficiency, external radiation to neck as part of cancer treatment, and viral infection to thyroid gland. Signs and symptoms. One thing to notice in hypothyroidism is that everything becomes slow. Let's consider each system. Heart. Decreased heart rate, decreased pulse, and decreased output of blood. Effects on gut are constipation and decreased appetite. Skin will be dry and pale, flaky with reduced sweating. I hate dry, flaky skin. Puffiness of face and eyes, and brittle nails. Effects on hair include dryness, thinning and hair loss, bad hair day every day. Manifestation in muscles, muscle weakness, body aches, and stiffness. Telltale sign in the blood is its decreased production, which is anemia, and increased level of cholesterol. Hypothyroidism can get on your nerves, resulting in slow reflexes and movements. Forgetting stuff? Well, hypothyroidism can cause memory loss. Sleepiness, irritated mood, and slow speech. In the reproductive system, low thyroid levels can lead to irregular and heavy menstrual cycles. Hypothyroidism changes your voice, making it hoarse and deep. Hypothyroidism can also cause fatigue, weight gain, and increased sensitivity to cold. If hypothyroidism occurs in the developing ages, it can shunt growth, mentally retard the individual, and delay puberty, if you have observed some of the signs and symptoms. How to confirm? By undergoing a series of lab tests. The primary indicator for hypothyroidism is serum TSH concentration, whose normal level ranges between 0.4 to 4 micro-international units per liter. It is the most specific, early, and first priority test for thyroid function, because small changes in thyroid levels can result in large changes in TSH. Subsequent tests include serum T4 concentration. Its normal ranges between 60 to 145 millimole per deciliter. It is not specific, but always tested if TSH levels are abnormal. Serum T3 concentration. Normal ranges is between 75 to 195 nanogram per deciliter. It is usually not recommended. Once the diagnosis is confirmed, what is the treatment? It is by replacing the thyroid hormones in the body artificially. This is called thyroid replacement therapy. It includes levothyroxine, which is a synthetic form of thyroxine or T4. It is the most commonly used treatment for hypothyroidism. Liothyronine, the synthetic form of T3, is not usually used because its action is short-lived. And natural thyroid, which is a mixture of T3 and T4 in the ratio 1:4. This is derived from extracts of cattle and pork thyroid glands. Because of its risk for hypersensitivity, it is not generally recommended. If hypothyroidism is not treated, it can lead to infertility, obesity, heart diseases like heart attack and heart failure, shunted growth in children, goiter, which is the enlarged thyroid gland, pregnancy complications like miscarriage and birth defects, and myxedema coma, a rare fatal complication of untreated hypothyroidism with high death rates. But God can do miracles. Symptoms are coma, decreased body temperature, and multiple organ failure. In short, hypothyroidism is a common disorder associated with the thyroid gland. Signs and symptoms varies. Causes are many, and treatment is crucial and lifelong. Thanks for watching. If you enjoyed, like, share, and subscribe. And don't forget to click the bell icon, and you won't miss anything on Impulse and Insight.